So this is the FD140i. This product is recently developed to replace a product that went before it, which was sourced from Salvia in Germany, called the FD140. So 3.5 years ago we set about developing the FD140i. The device has come into its own in recent times for the treatment of patients having COVID-19 in order to avoid them being intubated, or perhaps to facilitate an early extubation from whilst in the intensive care unit. The product is intuitive. It's switched on in the normal way with a push button, goes through a device self-check. Hopefully it will result in a green tick. Then asks you, do you want to calibrate the device for expediency? We're not going to calibrate the device for oxygen. We're just going to press no. And then gives you a choice then of going into one of 6 modes. We'll pick, for demonstration purposes, the CPAP mode, which is CPAP helmet mode, which is a use with a CPAP helmet. And our simulation system here has a CPAP helmet. It has a mechanical ventilator for the purposes of generating the patient's spontaneous respiration. Select the mode, press OK. Select the flow that you want, so it defaults to 60 in this mode, so we're going to put it up a little bit, so put it to perhaps 90. Oxygen percentage, let's put that up to 40. Press OK. We then want to set the alarms, which are a high pressure alarm of 12 and a low of 2. We'll leave that as they are. The frequency of the breaths alarm is set default at 20, so let's put that up to 30. And an apnea alarm, which is the period it takes until the machine decides that the patient is not making sufficient respirations, that's set at a default of 20, so let's put that up to, say, 26 seconds. And you're now ready to go. You press OK. You're then presented with a green forward arrow, so you want to press that. It does tell you, finally, do you really want to start the therapy? In which case we say yes for the green tick, and therapy starts. Therapy is indicated with a rotating pair of green arrows. So in our system here, with our artificial respiration, we can see that the respirations are beginning to show via the pressure trace on the screen. The CPAP, which we're intending, is 5 centimeters of water pressure. That's set with a fixed PEEP valve. And it's generally doing what it's meant to do in the simulation. It's recording 25 breaths per minute, and that'll stabilize after some time with the simulation rig. If we want to at any point change the settings, such as the flow rate, we first always got to unlock the screen, so press the locked red icon once. Do you want to unlock the screen? You do, so you press the green tick. And then if you want to change the flow rate from 90, you just press the icon where the flow is and perhaps change it to 120. Change the oxygen down from 40 to, say, 24. Press OK. It asks you, do you want to accept these changes? And you hit yes, and you can hear the system immediately start to change. The therapy is always timed from the start of the therapy. If we want to give the patient a short break from the therapy, we can pause the clock by just, as long as the screen is not locked at the time, you can just pause the clock and reset it. At any stage, we can set the alarms. There's an alarm icon. We can go back in and set the high and low pressure alarm. We can change the Fmax. Any changes that you make, it asks you for a confirmatory statement that, or a confirmatory action that you do want indeed the setting to change. So we change the Fmax from 30, say change it down from 30 to 25. And press OK. It asks you, do you want to do that? So again, it's confirmatory, and you can make the change.
How have the adjustments changed between the FD140 and the FD140i?
So the FD140 is a very basic device. It's intended just for basic CPAP. There are a number of significant clinical enhancements, one of which is the pressure trace. The pressure trace is sensitive to 0.1 decimal place. In the FD140i, it just gives you a simple 1, 2, 3, 4, 5 centimeters of water pressure. And it has no trace, so we can pick up a much higher resolution on what the patient is doing insofar as the compliance of the lungs and the patient's behaviour with the PEEP valve. And we can see that to 1 decimal place, where if this were the FD140, the value would sit at 5, whereas we're actually seeing it moving from, say, 5.1 up to 5.6.
And in terms of the alarm settings, is there anything additional in the alarms?
The alarm system is extensive insofar as it's protecting for the use of the device during transportation. So the onboard battery is very different to the FD140. It gives you significant warnings, incremental warnings, that when you're using the device on transport, you have a set remaining time that is expected to last before the battery runs out, and you get prompted with warnings, something that doesn't occur with this device. This device depletes the battery and shuts off.